Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance. Yet many CIOs and health executives choose to go it alone. Technology has taken center stage in healthcare. Get a coach in your corner. Visit healthlyrics.com to schedule your free consultation. 2 new services on the website. This Week Health Insights is for individuals looking to propel your health IT career forward. 2 emails a week designed to give you insights that set you apart. And This Week Health Staff Meeting is for teams, for managers really looking to introduce your teams to new thinking from industry leaders to get the conversation started on the right foot. If either of these are of interest, please hit the website and subscribe today. If you're going to be at the Health Conference in Vegas at the end of October, you're going to want to stop by a discussion that I'm going to be moderating on Tuesday, October 29th at 12:40 with VMware, Intel, and Deloitte. It's going to be a discussion on the opportunities, challenges, and promise of leveraging a multi-cloud environment for healthcare. If you are going to be there, please stop by. I'd love to see you. We caught up with Dr. Albert Chan, Chief of Digital Patient Experience at Sutter Health, for this short conversation following his keynote address at Health 2.0. Have a listen. Hope you enjoy. So here we are with the at the Health 2.0 conference. We're with Dr. Albert Chan with Sutter Health, and your title is?
Chief of Digital Patient Experience. Good morning.
Good morning. Chief, so what does that title mean? What are you working on at Sutter Health?
So I belong to an office called the Office of Patient Experience, which is an interdisciplinary team of leaders united together to transform and catalyze the transformation of the care experience for our patients and their families.
That's great. Like who else is in that office?
We have the Chief Medical Officer, Chief Nurse Officer, VP of Population Health, and VP of Patient Safety.
Oh, that's fantastic. So what kind of challenges are you guys looking to solve with that group? What are you really focused in on right now?
We catalyze change on behalf of the system. So really take on initiatives that are global in scale, looking for opportunities to improve and transform our health system in many, many ways. As an example, my role is to look at digital health technologies, digital health interventions, and improve the experience of care through those interventions.
Okay. What are some of those? I mean, you talked about some of them in your keynote, but what are some of those interventions that you've found that you've been able to scale and that really impact the patient?
Well, we're really proud of the fact that we keep the patient at the center. So our interventions, our initiatives are really with them in mind, and we try to focus our efforts trying to serve our patients in many, many ways. Some of the things I talked about in the opening kickoff were opportunities to do some very simple transactions that people need each and every day. I'll call it our digital health infrastructure, because it's really key for us. If we can't meet the patients where they are, then we really will have not achieved anything, even if we build whizzy cool things.
Right.
So as far as that digital health infrastructure, we've done a number of key initiatives. We've really boosted our patient portal adoption. We have 2.2 million patients enrolled in the portal today. Upwards of 500,000 patients who uniquely sign up to the portal each and every month. And they do all of their transactional needs. They message their doctor. We have in 2008, we had 16 million messages exchanged between our health system and our patients, for example.
That's fantastic. Yeah. Is that because you're in San Francisco, do you think, that you get a higher adoption rate because it's such a tech-savvy area?
Well, actually, it's important to step back and say, where do we serve? So Sutter Health actually serves over 100 communities here in Northern California, and you can find a community that's very much like any community in America inside of our health system. From the very urban areas like San Francisco, to the tech-savvy areas like Palo Alto here in Silicon Valley, to our more rural areas in Amador County and the Farm Belt out in Modesto. So we have a very wide range of patients that we serve, and they have various needs, but we've been able to achieve that engagement with that context in mind.
So you talked about a couple of things, and this is the kind of things we hear from patients as we have different interviews, but you talked about scheduling and rescheduling. Can you go through that use case a little bit? I mean, that seems to be such a great use case around really improving the patient experience.
Sure. Well, I showed a slide on screen, I don't know if you recall, where I showed a picture of a very complicated maze and matrix, flowcharts. And for many people, that's what it feels like. Trying to do a simple thing like get to see your doctor is not an easy thing to do. And if you think about your non-healthcare life, your consumer life, it's pretty easy to do things on the web, for example, to book things. So a few years ago, we undertook the endeavor and said, hey, how can we make this better for patients? How can we make it easier for people to schedule the care that they need? And that's why we took up online scheduling as a key centerpiece of some of the work we're doing.
So you talked about the ability when people cancel their appointment for people to be moved forward in terms of their scheduled appointments maybe 2 weeks out.
Yeah, so just some summary statistics. As I mentioned, we serve over 3 million patients annually at Sutter Health, and several million of those patients in the ambulatory or outpatient service. And so we said, how do we make it easier for those patients to seek care? One thing is just make it easy to schedule. So we've really focused on that, made it easier for our patients to schedule appointments. And to the point now where over 30 specialties are able to, patients in over 30 specialties are able to book a return visit appointment, for example.
Yeah.
But that's the first line. Then you think, well, geez, sometimes when you get that initial appointment, either by phone or online, it's not as soon as you'd like. That happens. Our doctors are very busy, very popular. So how do we provide the service for patients if should an opportunity prevail itself? And so we've created digital wait lists. Wait lists that allow patients to say, as they're booking the appointment, in real time, they check a box that says, hey, consider me for an earlier appointment if an earlier appointment shows up. Yeah. And through the simple intervention of a text or an email, when patients are reminded of their upcoming appointment, it makes it very easy for people to tell us that they can no longer come, or confirm that they are coming.
Right. And
when patients say that they can no longer come, we automatically offer that appointment to someone else. We've been able to do that over 600,000 times thus far. And patients who accepted those offers were able to see their primary care doctors 14 days sooner, and for specialty care, 22 days sooner.
That's fantastic. And I would imagine that cuts down on potentially your specialist with empty spots on their calendar where people cancel or need to reschedule.
Well, the most frustrating thing for a busy doctor is that they want to take care of people, and then they see a valuable slot go unused, right? So if we can better match patients with available opportunities for care, that's fabulous. And that's what we've tried to do.
Can you give us, last question, just on the symptom checker. So you have the symptom checker out there. I know that Google's doing this and some others are starting to do this. Talk about yours and what you're doing for the community that you guys serve.
One point is we're part of a greater community at large. So unlike some other interventions, this intervention is targeted towards the community at large. So any patient any consumer or patient who decides to log into sutterhealth.org, our website, our public-facing website, can access this service. And so, in my way of thinking, this helps improve the health of the community as a whole.
Right.
It doesn't necessarily have to be a Sutter Health patient to leverage this. And what we're doing there is we know that patients have questions, and it's a pretty frustrating thing, I think, to be able to try to get care, to try to access care, and end up at the wrong place. Yeah. So if you could have, or show up to a visit that you didn't need to show up to. Yeah. So through the power of AI and through the symptom checker, the idea is have a conversation with our patients, create those human connections that we're all about, whether it be in the middle of the night or early in the morning, and then they can have a AI-based conversation with this symptom checker, get a sense of what are the possibilities for the symptoms they're experiencing, and hopefully get assistance to where they should get, what's the best place to get care.
Right. So does that workflow lead to direct them to telehealth or primary care or a specific emergency center, those kind of things?
Right now, we offer a navigational guidance to our emergency room centers, same-day services. We are about to launch other services into primary care and telehealth services. That's coming in the very near future.
Fantastic.
Yeah.
Well, thank you very much. Appreciate your
You're
time.
welcome. You're welcome.
That's fantastic. I really appreciate Dr. Chan taking the time after his keynote to sit down and talk to us about pragmatic digital health innovation. Good stuff. Please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday we take a look at the news, which is impacting health IT. Keep your feedback coming, Bill at thisweekinhealthit.com. It's all really helpful, good, bad, or indifferent. It helps us to make a better show for you. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or the YouTube channel thisweekhealth.com, and go to the top right, click on YouTube is the quickest way to get there. Thanks for listening. That's all for now.